Hi again. This video is a primer on blood flow into the internal carotid artery. As you can see here, we're starting from the previous video that we made on a drop of blood following the vasculature through the maxillary route, which ultimately came from the external carotid. And what I want to do for this video, I'll draw it in magic colors. How about that? We're going to follow a drop of blood that goes into the internal carotid artery. Now, the internal carotid artery has no branches in the neck, unlike the external carotid artery, which has all of these branches, or even the the subclavian artery, which has all of these branches. The most important, of course, of coming off the subclavian is the vertebral artery, as it courses. Here's our vertebral through the transverse foramina to go into foramen magnum. Which, as you might remember, is going to anastomose at the basilar artery. But let's go back to the internal carotid artery. So our drop of blood goes into the internal carotid artery, and then it takes some pretty weird turns. So this is a view. Let's see here. There we go. The upper left image is a posterior view of the internal carotid artery. There's a few things to note here. The first is that the artery goes through the opening to the carotid canal. And the carotid canal takes a weird turn. Now, on the image, it looks like it's going superiorly and to the left and then up. But in reality, it goes superior and anteromedially and then up. So you can see it actually better angled here. The carotid canal is located here in this structure. It looks like it's drawn here on the right. This is the canal drawn in yellow. So notice the canal angles, traverses anteriorly, but goes from posterior to anterior medially. So an anteromedial direction that way. And then once it emerges from this region right here, which is above the foramen lacerum, it will turn anteriorly and then hairpin turn around the anterior clinoid process. So this is the anterior clinoid process here. The artery actually goes around this and then will branch to become the middle cerebral artery here. And of course, there are arteries that contribute to the circle of Willis, as the circle is located in this region here, like that. Okay. That's where the circle of Willis would lie. So let's go back to this upper left image. Let's blow this up. And as we're following the carotid artery as it's going through that canal, notice here again, this is a posterior view, the artery is going to turn anteriorly, hairpin, go back, and go around the anterior clinoid process. One of the things that I wanted to note here, as the artery is coursing through, is that it is moving with several nerves, which I'm going to highlight in green. They're already drawn here for you, but we have a nerve here, a nerve here, and a nerve here. So this is cranial nerve 3, cranial nerve 4, and cranial nerve 6. Each of these nerves are going to go through the superior orbital fissure and innervate the extraocular muscles of the eye. So let's imagine that we're going to take a plane, a section, out of where these vessels are crossing. Let's see here. Let's draw this in purple. So we're going to take a cut right through, let's say, here. And we're going to take that cut and we're going to transfer that cut to this image here. So now what you're seeing is a posterior view of the area called the cavernous sinus. And lo and behold, here are the same nerves, cranial nerves 3, 4, and 6 that are traveling with the internal carotid artery in the cavernous sinus. Now there are 2 other nerves here. Here's 3, 4, and 6. I just want to emphasize that. There are 2 other nerves that are located here, and that is the ophthalmic nerve, V1, and the maxillary nerve, V2. I'm going to draw this in a different color now so that you can see it. So here's V1, and here's V2. So V1 is going to go into the superior orbital fissure with the extraocular muscle nerves, but V2 is going to enter into foramen rotundum. So V1 goes through the superior orbital fissure, and V2 goes through foramen rotundum. Where is V3, you might ask? Well, V3 is not located here because V3 is going to go down into foramen ovale, which isn't shown in this diagram. So one of the cool things about the internal carotid artery, going back to that, is that this is the only place where I'm familiar with an artery traveling within a vein. And this vein is the dural venous sinus. Right here is, if I were to draw the dural venous sinus, or the dural layers, draw that here. Here would be the endosteal layer or periosteal layer, however you want to name it, and then here would be the endosteal layer. And so where this happens, now notice there is a splitting of the dura in this region. The dura would continue this way. And in this region it's going to fill with blood. And just to give some context, here is the cavernous sinus, and this, we're looking from a superior view now. This is the region of the dura through which the internal carotid artery and those nerve branches 3, 4, 6, V1, and V2 are traveling. From the side, here is the cavernous sinus. Okay. Okay, so the important part about this is that the internal carotid artery, as it's traveling through the cavernous sinus with these nerves, if I were to look here and look in this direction, this artery, which looks like a circle in this profile and a circle in this profile, would actually be traveling like this. And then from here, the artery branches out and goes this way to become the middle cerebral artery. Okay, I think that's it for the internal carotid. Oh, I do want to mention the eyes. So here is another view. This is a superior view now of the internal carotid artery as it's done its hairpin turn. There we go. One of the major branches that comes off the internal carotid is the ophthalmic artery. So the drop of blood could go through here, and then it divides into a bunch of branches that are going through the orbit, which is actually really fun to dissect. Notice that the ethmoid arteries, there's an anterior ethmoid artery and there's a posterior ethmoid artery. These arteries are going to go into the ethmoid bone and will anastomose with none other than the dorsal nasal artery here. So here's where the anterior ethmoid artery will come out. And so there's anastomosis between the ophthalmic artery and the dorsal nasal artery in the orbit, this region right here. So going back to the eye. Oh, and look at this. Here's that middle meningeal artery. I realize that's not in the eye, but you can see it here now on the petrous part of the temporal bone. So back to the eye. The vessels of the eye will supply the lacrimal gland, will supply the sclera, and there's the central artery of the retina, which is located here, and that will supply the retina, of course. And then the superior orbit, and then the trochlear region. So lots of divisions there. So how do we drain back from this region? Well, let's go back to, this is a lateral view now of the venous drainage. So the key point to see here is that after we've supplied the organ, the blood can drain back into the cavernous sinus. This is an important drainage region, or it can go down here into the pterygoid venous plexus, which isn't drawn. So the pterygoid venous plexus will go down towards the neck, but the cavernous sinus will go towards the dural venous sinuses, or it's already in the dural venous sinuses, which goes to the internal jugular. Of course, in the neck, this goes to the internal jugular as well. The venous drainage needs to get back to the heart, and it'll either go through the internal skull table or go right down into the neck. One of the things to keep in mind is the veins of the head and neck have no valves. So infections that are located here, bugs that are located here, they can travel, if they get into the venous drainage, all the way back into the internal part of the skull and the brain, and can cause all sorts of bad things. But the body's pretty good at protecting itself from such things. Okay, I think that's it for the internal carotid artery and the eyes. We'll see another video on the cerebral vasculature. All right, that's it for now. Thanks. Bye.